Alright, so back to this. Torn knee cartilage, also known as meniscus tear. The knee contains two pads of cartilage, menisci, that act as the shock absorbers between the femur, thigh bone, and tibia, shin bone. Tearing of the cartilage. A meniscus tear usually occurs as a result of sudden twisting of the leg. It is common sports injury. Symptoms typically include sudden pain in the knee, swelling of the knee, and difficulty straightening the leg. A mid-tear may be treated with rest and non-steroidal anti-inflammatory drugs. A severe tear may require surgery to repair or remove the damaged cartilage. That is true. Patellofemoral pain syndrome. Patellofemoral pain syndrome is the medical term for pain around the front of the knee that is not associated with any signs of damage or problems in the knee. Typically, the pain is worse when walking up or down stairs. There may also be swelling around the kneecap and a grating sensation when the knee is bent or strained. It is common in people who play sports. Treatment is with rest, pain relievers, and physical therapy. They made a mistake here. It may take several months to fully recover. Sometimes the condition persists for years. Plica syndrome. Kneecap. Okay. Plica syndrome. Plica is the fold of the membrane in the knee that is thought to be a tissue that normally disappears during fetal development but persists after birth in some people. Its presence or absence makes no difference to the function of the knee. In plica syndrome, the plica becomes inflamed, causing pain at the inside front of the knee. The pain is usually associated with bending the knee and becomes worse during and after exercise. Treatment is with rest, pain relievers, and corticosteroid injections to reduce inflammation. If this treatment is successful, surgery might be suggested. Oh man, so people around birth, they don't get saved, man. People with birth, you gotta fix this, man. You know what I'm saying? All right, so Baker's cyst. A Baker's cyst is a fluid-filled swelling that develops at the back of the knee. It may be a feature of disorders such as osteoarthritis and rheumatoid arthritis. It may also be caused by knee injury. Most cysts are painless. Occasionally, a cyst may rupture, causing pain in the calf. In many cases, a cyst disappears by itself. A large, painful cyst may be treated with pain relievers and corticosteroids to reduce inflammation. Rarely, a cyst may need to be drained or surgically removed. I hear a lot about corticosteroids, medications, so that's very common. All right, next one, ganglion. A ganglion is a fluid-filled cyst that develops under the skin near a joint or tendon, most commonly on the wrist or back of the hand, but sometimes on the foot. Ganglia are not harmful and may be present for years without causing problems. Although some cause pain or restrict movement, if they cause no symptoms, they can be left to disappear by themselves. If they cause pain or impede the movement, they can be drained or removed surgically. Another cyst. Alright, bunion. Oh, I heard some people get bunions. Like old people get bunions, man. Like in their 60s, something like that. Alright, a bunion is a thickened lump at the base of the big toe. The underlying cause is a minor bone deformity called the hallux valgus, in which the joint at the base of the big toe projects outward, forcing the toe to turn inward. Pressure on the projecting bone causes the surrounding tissue to thicken, forming a bunion. A bunion may be painful and become inflamed and calloused. Small bunions may be remedied by using bunion splint to straighten the big toe. For large or troublesome bunions, surgery to remove the protruding area of the bone, strain the big toe may be recommended. bunion, and the normal outward projection of the joint of the base of the big toe leads to thickening of the soft tissues around the joint, resulting in a bunion. Soft tissue becomes thickened, producing part of the joint. Yeah, this happens when too many cells come in and they start growing and growing and growing. It's not like an injury or anything. It just happens over time. And then joint instability, shoulder instability. Normally, the bones, ligaments, or muscles of a joint work together, support the various parts of the joint in their correct positions while also allowing the full range of motion of the joint. In joint instability, there is lack of support, which is a result that the joint may not move correctly or may be dislocated easily. In shoulder instability, for example, the shoulder joint feels abnormally loose, and there may be symptoms such as tingling, numbness, or weakness in the arm. In extreme cases, the shoulder may dislocate. Treatment may involve physical therapy and anti-inflammatory medication or surgery to stabilize or repair the joint. If the joint is dislocated, it will need to be manipulated back into position. Okay, so this one, dislocation. When you get injured, yeah, that's when you get injured. That's when not stabilized. All that bad stuff. All right, so a dislocated joint, dislocated kneecap, shoulder dislocation. In a joint dislocation, the bones of the joint become displaced, usually as a result of injury. A dislocation is often accompanied by tearing of the joint ligaments and damage to the membrane encasing the joint. There may be also damage to nearby nerves, tendons, and blood vessels. Symptoms typically include severe pain in the affected area, deformity of the joint, and swelling and bruising around the joint. Treatment usually involves manipulating the joint back into place, followed by immobilization in the split or cast. In some cases, surgery to reposition the joint and repair any damage may be needed. Dislocated head of humerus, dislocated shoulder joint. In this colored x-ray, the head of the humerus upper arm bone has come out of the joint socket at the end of the shoulder blade. Yeah, that happens when you do something too rough. You know what I'm saying? Whiplash. Whiplash is a neck injury caused by a sudden, violent back and forth or sideways movement of the neck. It commonly occurs in road traffic accidents, for example, due to sudden deceleration or acceleration in vehicle collision. Oh, and talking about the dislocated joint, this happens also in road traffic accidents too. Okay, continue on. The severity of the whiplash injury varies from small strains to major trauma in which neck ligaments are torn. The sudden pull of muscles and tendons on bones may break pieces off the ends of the vertebrae. Nerves and blood vessels may also be damaged, causing pain in the neck, shoulder, and arms, and possibly dizziness and vision problems. There may be muscle spasms, swelling, and stiffness in the affected area. It may take several hours for symptoms to develop after the injury, and they may become worse over the next few days. Whiplash usually gradually improves on its own over several weeks with measures such as ice packs to reduce inflammation, pain relievers, and keeping the neck as mobile as possible. If symptoms persist, physical therapy may be recommended. Alright, and here we have cervical spine, disc, ligament tear, disc pinch between vertebrae. Yeah, it's small little things that can cause a big difference in here. Sudden acceleration, a sudden force from behind, for example, due to collision from behind in the traffic accident causes the head to jerk backward, hyperextending the neck, the head then rebounds forward. Sudden deceleration, a sudden violent force from the front, for example, due to colliding with the stationary vehicle causes the head to jerk forward, flexing the neck. The head then rebounds backward. Muscle cramps, sudden muscle spasms in which a muscle or group of muscles become hard, painful, and tight often occur during physical exercise and are common causes sitting or lying in an awkward position. Certain medications may also cause cramps, and cramps may sometimes be a symptom of an underlying disorder. Often, however, there is no apparent cause. Stretching or massaging the affected muscle usually relieves cramps. For severe or recurrent cramps, A doctor may prescribe a muscle relaxer or quinine, an anti-malarial drug that can also relieve cramp and investigate possible causes. I didn't know that. Polymyalgia rheumatica. Polymyalgia rheumatica is an inflammatory disorder that mainly affects muscles of the hips, thighs, shoulders, and neck, causing pain, stiffness, and inflammation. The cause is unknown. The main symptoms are painful, stiff muscles in the morning, fever and night sweats, tiredness, weight loss, and depression. Symptoms may be accompanied by those of giant cell arthritis, such as headaches and scalp tenderness. Treatment is with corticosteroids to reduce inflammation and relieve symptoms. Often, treatment needs to be continued for about 2 years or sometimes longer to prevent symptoms recurring. Okay, next page. Ligament sprains and tears. Ankle sprain, also known as anterior cruciate ligament, ACL injury. Chronic ankle instability, CAI. Medial collateral ligament, MCL injury. Posterior cruciate ligament, PCL injury. Ligaments are bands of tissue that hold bones together at a joint. They are not very stretchy and are prone to tearing, especially when subjected to sudden, forceful twisting. The injury may range from a minor tear called a sprain to complete rupture of the ligament. The most commonly injured ligaments are those in the knee, the medial collateral ligament, MCL, anterior cruciate ligament, ACL, posterior cruciate ligament, PCL, and ankle. Symptoms include sudden pain in the injured joint, swelling, and restricted movements of the joint. Most minor injuries can be treated with self-help measures such as price protection, rest, ice, compression, and evaluation, and pain relievers. A severe injury should receive medical attention as it may require surgery to repair or replace the ligament. Sprained ankle. The ankle is prone to sprains if the foot twists suddenly. A common injury sprain is a sprain of lateral ligaments due to the foot twisting inward. Tibia, shin bone, torn lateral ligaments, fibula, talus, calcaneus, heel bone. Okay. Yeah, this happens a lot in athletes, I bet. Spinal muscular atrophy. Spinal muscular atrophy, SMA, is an inherited disorder that causes muscle wasting, atrophy, muscle weakness, and loss of movement. Symptoms may include weakness in the limbs, movement problems such as difficulty walking, tremors, swallowing problems, and breathing difficulties. The most severe type of SMA affects babies less than 6 months old and is usually fatal within the first few years. The least severe type begins in early adulthood, tends to cause relatively mild symptoms, and does not affect life expectancy. There are no cure for SMA. Treatment is aimed at managing the symptoms. Okay, this is another one where the babies get hurt like that. Alright, torticollis, also known as wry neck. Torticollis is twisting of the neck, causing the head to tilt to one side. There may also be neck pain, stiffness. Torticollis is commonly due to minor neck injury or sleeping or sitting in awkward positions. Less common causes include certain nerve disorders or cervical spondylosis, arthritis of the neck. Torticollis can usually be treated with pain relievers, heat treatment, massage, and gentle neck exercises. Muscle relaxants may be prescribed for persistent or severe cases. Okay, restless leg syndrome. Restless leg syndrome is categorized by an irresistible urge to move the legs and an unpleasant tingling, burning, prickling, or aching sensations in the leg muscles. Symptoms tend to come out at night and can interrupt sleep. They may also be triggered by prolonged sitting. Causes unknown. Mid causes may be alleviated by self-help measures such as cooling or warming the legs, walking around, or relaxation exercises. More severe cases may be treated with medications such as the anti-Parkinson drug levodopa or anticonvulsants. Fibromyalgia. Fibromyalgia. Myalgia. Fibromyalgia is a long-term condition that causes widespread muscle pain. The cause is unknown, but the condition often develops during periods of stress. In addition to pain, other symptoms may include tiredness, headache, difficulty sleeping, diarrhea, constipation, difficulty concentrating, anxiety, depression, and in women, painful periods. Treatment is aimed at relieving symptoms. It includes medications such as pain relievers, muscle relaxants, and antidepressants, psychological therapy, and relaxation techniques. Sever's disease. Fibromyalgia, that sounds kind of common. That sounds like a common condition. Alright, Sever's disease. Sever's disease is a painful inflammation of the bottom of the heel that affects children between the ages of about 8 or 14 years old. At this age, the heel bone is not fully developed, and repeated stress on it, for example, from playing sports, can cause inflammation of part of the heel bone that is still growing. Treatment for Sever's disease involves avoiding any activities that cause the pain, non-steroidal inflammatory drugs to reduce pain and inflammation, and heel support and shoes. Physical therapy may also sometimes be recommended. Like I think the Jag company is a good place to start, I guess, for physical therapy. Okay, so myasthenia gravis. In myasthenia gravis, the immune system attacks the receptors in the muscles that receive nerve signals, resulting in muscle weakness. The condition is sometimes associated with a tumor of the thymus, an immune gland in the neck. Symptoms may include drooping eyelids, double vision, slurred speech, difficulty chewing and swallowing, weakness in the legs and arms, and breathing difficulty. Treatment may include medication to improve transmission of nerve signals, immunosuppressants, and sometimes surgery to remove the thymus. If symptoms suddenly become severe, urgent medical treatment is needed. Rotator cuff disorders. The rotator cuff is a group of muscles and tendons around the shoulder joint that keep the head of the humerus, upper arm bone in the shoulder socket, and are also involved in shoulder movements. Repeated overhead arm movements may cause inflammation or a tear in the rotator cuff, producing pain in the shoulder and restricted arm movement. A minor tear or inflammation can usually be treated with rest, ice packs to reduce inflammation, and over-the-counter pain relievers. A doctor may also sometimes recommend corticosteroid injections and physical therapy. A severe tear may need to be repaired surgically. Okay, there's a lot of them, of conditions of the muscles. Yeah, there's a lot of muscle things going on here. Piriformis syndrome. A piriformis muscle is located in the buttocks near the top of the hip joint. In piriformis syndrome, the muscle spasms and presses on the sciatic nerve, which runs from the buttocks down the leg. This causes pain, tingling, or numbness in the buttocks and sometimes down the back of the leg. Treatment for piriformis syndrome typically involves reducing pain by relaxing the muscle using heat or cold massage and physical therapy. Pain relievers may also sometimes be prescribed when symptoms have subsided. Special exercises may be recommended to help prevent the condition from recurring. Compartment syndrome. Compartment syndrome occurs when excessive pressure builds up within an enclosed group of muscles called the compartment, usually as a result of bleeding or inflammation. Acute compartment syndrome develops rapidly, usually due to an injury such as a fracture, and causes intense pain. It requires urgent surgery to relieve the pressure. Chronic compartment syndrome develops gradually, is often due to excessive exercise, and typically causes cramping pain that begins during exercise and disappears with rest. It can usually be treated by avoiding exercise, physical therapy, and non-steroidal anti-inflammatory drugs. Okay, I don't know what to say about that. Alright, muscle strains and tears. Hamstring injury groin strain, stiff neck. Muscle injuries range from a mild strain, sometimes referred to as pulling a muscle, in which the muscle fibers are overstretched, to a complete tear. Strains and tears often occur as a result of heavy physical work or strenuous activity during sports. Almost any muscle can be strained or torn. Those commonly affected include muscles in the lower back, legs, and groin. Typical symptoms may include pain in the affected muscle during use and sometimes also at rest, swelling and bruising in affected area, and muscle spasms, painful muscle contractions. Most cases can be treated with price protection, rest, ice compression, elevation, and pain relievers. A doctor may also recommend physical therapy or mobilizing the affected area with a splint, brace, or cast. Severe injury may require surgery to repair the damaged muscle. Pelvis, femur, thigh bone, tendon, semitendinous muscle, semimembranosus, muscle site of tear, biceps femoris, muscle, torn hamstring. The hamstrings are the muscles at the back of the thigh that bend the knee and pull the leg back. Hamstring injuries are common in athletes who do a lot of sprinting or jumping. Like if you're carrying heavy things, you can like the younger you are, the less prone you are to having an injury like that. However, if you're older, then you have more it's more visible to be injured at that point. That didn't make sense what I just said, but I know what I said. Shin splints, known medically as medial tibial stress syndrome. Shin splints is a pain in the shin, usually caused by exercise such as running. The pain tends to affect both shins. It typically starts soon after beginning exercise. It becomes increasingly severe while exercising, then gradually disappears with rest. It can usually be treated by avoiding the exercise that causes the condition, by using ice packs and pain relievers to reduce pain. Yeah, like using icy hot, all those medications can help out.